You're listening to Health Professional Radio. My name is Wayne Bucklar, and today my guest joins me from Perth in Australia. He is Dr. Jayson Oates, and he's the Medical Director of the CALIBRE Clinic, and we're going to talk to him about what CALIBRE Clinic does, but in particular, My Face, My Body has just named him in the Ultimate 100 2017 list for the CALIBRE procedure, and we're going to ask about that experience as well. Dr. Oates, welcome to the program.
Nice to speak with you, Wayne.
Now, Dr. Oates, tell us about the CALIBRE Clinic and what it is you do and who you do it for.
Well, Wayne, it's a new thing. My practice in Perth, which is Academy Face and Body, is a cosmetic surgical practice, and I see people for facelifts and nose jobs, and we do Botox and body treatments and all of those things. We're a large clinic. We have 3 doctors here, 3 nurses doing injectables, 3 therapists doing various treatments. And a few years ago, I had a couple of men in sequence sort of just ask in passing, is there anything that we could do to increase the size of their penis? And we didn't have anything available. And they didn't want to have surgery. The surgery was far too invasive, and it's not that big a deal to them. But they said, well, you've got all these other treatments. Why don't you have a simple treatment for increasing the size of the penis? And so I did a lot of research and reading articles and found that they were doing it in Korea. And in fact, it's a very popular procedure in Korea. And a number of articles had been written by some urologists who are the bladder and penis expert doctors. And I was looking at what they were doing and thinking, well, these guys are urologists. They're not cosmetic injectors. And I think this procedure could be done a whole lot better. And so we just started to investigate what could be done, how it could be done better, and how to make it the best possible procedure that it could be. And then we ended up with CALIBRE.
Now, Dr. Oates, I know this is a serious topic, and for lots of people, a very serious topic. Why hasn't this kind of just been routine forever? Why has it come about now?
It's interesting that there hasn't been more interest. Certainly over the last couple of years, the interest is increasing. And in my time, I certainly find that there are now more doctors scattered around the world who are starting to do it. My expertise was initially in the face, and in fact, everybody who's doing injectable fillers, their expertise is in the face. And so the penis was sort of a foreign land, and none of the companies were making a filler specifically for the penis. And so, it just didn't seem to come up, so to speak. But with the increase of the less invasive procedures, people wanting to be able to have something that is a small thing that makes them feel more confident and comfortable in their appearance. I guess it was an inevitable thing that was going to be developed. And we're finding that injectable phalloplasty, injecting fillers to increase the girth, especially of the penis, is becoming more and more popular the more men know about it. Now,
as a injectable procedure, I'm assuming this is quite a quick and basically a treatment room procedure rather than anything surgical.
Well, certainly when we were designing the CALIBRE procedure, we had a list of criteria that we thought it needed to be. It needed to be painless, a walk-in, walk-out, no downtime, and to be particularly safe. This isn't sort of an area where anybody wants any messing around. And it's like all cosmetic procedures, there's a low tolerance for complications. Mm-hmm. But I think for men, this is an area where you really don't want anything to go wrong. And I think that's also why the uptake of surgery for penis enhancement and size is still a really rare procedure, because it's a very invasive surgical procedure. But we found that we were able to make it pain-free, essentially with local anesthetic cream. We've had to work a while at getting exactly the right filler, something that is going to feel right and is going to last a long time. And I guess the main thing is it needs to be done as a sterile procedure. There is a specific infection that can happen in the penis and in the scrotum called Fournier's gangrene. And it's not something that you see anymore, but when it happens, it's like you hear the flesh-eating virus,
yes.
necrotizing fasciitis. It can be a very devastating infection. I do have people contacting me from around the world who've had injections done in perhaps less than ideal circumstances, who have had this infection occur. And, it can turn into a bit of a disaster very quickly. So I guess, yes, for our patients, they find it's a quick and simple procedure, walk in, walk out. It takes an hour, and there's really no downtime. Like a lot of things in medicine, there's a lot that goes on behind the scenes to ensure that that's what the patient experiences.
You're listening to Wayne Bucklar, and I'm in conversation with Dr. Jayson Oates, who is the medical director at the CALIBRE Clinic in Perth, and also at www.academyfaceandbody.com.au and www.calibreclinic.com.au. Dr. Oates is a cosmetic surgeon, and we've been talking about, for want of a better word, I guess, injectable penile enlargement. Now, Dr. Oates, with everything there are pros and cons, what are the selection criteria that someone's going to go through in their head to lead them to having this done?
Yes, it's one of these things, again, when we were developing it, so, well, if you had this walk-in, walk-out painless procedure, what percentage of guys are going to be interested in increasing the size of their penis? And we were thinking, 99%, and 1% are going to lie. So there's a lot of guys who've got some interest in it. There are some guys who have this underlying background anxiety about the size of their penis. And I work with a PhD psychologist who works specifically in this area. We published one paper earlier this year, and we've got another couple sort of in the pipeline at the moment. And some people would say, well, this is a psychological problem. It doesn't really matter how big your penis is. And I guess it's a bit like anybody who wants to have any cosmetic surgery, a facelift or a nose job, or in fact, if you get your hair coloured, or if you match your shoes to your belt, or you buy yourself a new handbag, or whatever it is, a lot of people spend a lot of their time, effort, and money on things that perhaps aren't necessary, but just make them feel better, make them feel more comfortable, confident in their appearance. And that's what the procedure is about, and that's what it is for the majority of men. And then the question comes up, well, what about that medical condition of micropenis, where the erect penis in this definition is less than 7.5 centimetres, so less than half of perhaps what is average. And in that case, this procedure isn't really a correction for micropenis. It's more for your average everyday guy, maybe totally average in size, maybe slightly bigger, slightly smaller, doesn't matter, but just wants to have that feeling of a slightly bigger penis.
Now, what's on the other side of the coin? You mentioned micropenis, but what other things would prevent people from having the procedure?
There, in the blog that I write on the CALIBRE Clinic website, I listed the 5 conditions that make you an ideal candidate for the CALIBRE procedure, and they are having an average size penis. So I've had a few guys who have really big penises, which is not a problem. It's just that to make a substantial size difference to them, you've then got to put even more product in. And again, if it's a micropenis, then this isn't the solution. Technically, it's easier to do it on a circumcised penis than on an uncircumcised penis, because you've got a more limited area where the gel can be placed. That makes it easier. But of course, the vast majority of young men now are uncircumcised. Yeah. And most of our patients now are uncircumcised, and that's fine, and we can work with that. There's a condition that most men are familiar with, or a term, being a shower or a grower, yes, or what you might call shrinkage. So if you're a guy who suffers a lot of shrinkage, it means when it's flaccid, it's a lot shorter, and when it's erect, it becomes a lot bigger. For guys who get a lot of shrinkage, that can bunch the product up a little bit after it's been injected. And so that's, again, not an advantage when we're doing the procedure. However, it's often guys who have a lot of shrinkage that are very keen on having the procedure. So we've got ways around that as well. I guess the number one thing that we want to avoid is anybody who's got infection in the area. Mm-hmm. And that's sort of perhaps the contraindication to having the procedure.
Fascinating to talk to you today, Dr. Oates. I'm sure that it will be a segment which proves to be very popular on the radio, because every time we do men's health, we find there are lots of men come out of the woodwork for something that they can learn about without being too exposed. So I'm sure we'll have lots of interest. How do people get in touch with you?
The easiest way, and in fact this is in fact what most men find the most difficult part, is getting in contact with us initially. CALIBREClinic.com.au, there's a live chat function and email. We've got a clinic in Sydney, in Crow's Nest, as well as our clinic in Perth. Soon, we're going to start doing training for other doctors, because we're soon getting to the point where we're not going to be able to treat all the men that we've got who are interested in it. And of course, there are patients from all around the country that are keen on having the procedure. So we're going to need to train doctors around the country. But the website is probably the easiest way for people who are really interested to find out more. There's a lot of information and all of our contact details there.
Dr. Jayson Oates, Medical Director at CALIBRE Clinic and at the academyfaceandbody.com.au. Good luck with the My Face, My Body Awards coming up in Sydney shortly, where you're a finalist. And we look forward to perhaps hearing that story after it happens in November, when the awards have been handed out. We might have another chat with you. Thank you for sharing your time with us today. I do appreciate it. I know you're a busy man.
Very nice talking to you, Wayne. Appreciate it.
Now, I should mention for my listeners that the advice that Dr. Oates has just given is, in fact, not medical advice. It is advice of a general nature. And should you be looking for medical advice, please seek specific medical advice from your practitioner rather than rely on information on this program, which is for entertainment purposes only. If you've missed my conversation with Dr. Oates, the good news is, on our website, we have a transcript of the whole interview. You can also listen to the audio archive in full on YouTube, SoundCloud, and iTunes. My name is Wayne Bucklar. This is Health Professional Radio.